These are great statistics for us, and they're not alarming. This is fantastic. So what are these people looking for? Because that might be your question. Well, what I found out through the research was that 66% of them look online about a specific disease or a medical problem. And I highlighted that, and I want you to write that down. Because if you're starting to think, well, what do I talk to people about on the internet? What are they looking for? Specific diseases and medical problems. And so what I'm trying to say to you is that because of the way Google is doing things now, for them to actually find your website is now becoming more and more difficult. It doesn't mean that they can't find you, but more than likely, they're going to find you from your Google Places listing. And Google is giving the biggest amount of real estate, because that's the first thing that prints, is to these Places listings. So you want to claim your listing. You want your listing to look good, because I'll just ask you, if you're looking at a page and you see a bunch of things that are just listed there, who do you think they're probably going to select first? I think they're going to go right to this guy right here with the 5 stars and the 5 Google reviews. Now, the only way that you can get a Google review is if somebody goes to your Places page and clicks review. Google is only allowing people who are registered Google users to have this kind of listing. Am I making sense so far? Because I don't want to lose anybody. Why this is important is because you may be getting reviews from other sources like City Search or from Demand Force or Smile Reminders. Those are great reviews. The problem for us is they don't show here. Google has removed all of those, and it's something that they're rolling out across the country, and it may not have happened in your town, but it will get there. You see, I know they call on the phone and they trap you. I hear it all the time. Hi, do you take insurance? Do you waive copay? Do you do bleaching? Are you open on Sunday? Do you have a hygienist? Is your doctor nice? Does he have kids? Has he ever been sued? Right? Right? Bombards you, and you think you're being polite, so you just start answering all their questions. Yes, yes, no, no. Well, I think once. Yeah, he came out of it. No, 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 no big settlement. Da da da. And the patient goes, well, thank you so much. You're so sweet. I'm just shopping around, and if I want to make an appointment, I'll give you a call. How many times does that happen? Because when they ask all the questions, they tend to control the conversation, and they control it by ending it. I find many patients are like, wow, this is better than I thought it was going to be. I know you don't know me, so it seems a little bit like hype, and I'm asking for a little blind faith, but as you get accustomed to communicating and talking and controlling the conversation in a healthy manner, people like it. And when they feel good, they say yes. They say yes to the appointment. But we're now just one step closer to getting them to accepting treatment. I'm just trying to get their attention. And so this gets them to think about it. So you get all the boring details and all those kinds of things. There's a couple of things that I did that you may or may not have noticed, but I want to point them out. There are 3 bits of information that you can convey to any patient that will allow you to develop a professional rapport with them instantly. And I just did it. And I'm wondering if you picked up what those 3 bits of information were. How does that benefit the team? Because if you could do $75 an hour, that's an additional $600 a day. Doesn't sound like much, but when you add it over all the days that you work, let's say if you work a typical 16-day month, an extra $600 a day would generate $115,000 in additional revenue. That would boost your productivity 25% just by doing an extra $75 an hour every day. Just thinking of these little places. Maybe it would be another fluoride treatment. Maybe it would be another FMX that we skipped. But $115,000, what does that mean? It's going to bring another $46,000 in operating profit. You think that's going to help the doctor do some renovations and buy some new technology and all that? Beyond that, what about some raises? Because out of that, there's another $23,000 available for wages. If you're a typical dental staff of 5, that means $4,608 that the doctor could give to each team member. And I would say not even bat an eye, because you want to know why? It would be in the budget. We planned for this. I'm all for spending the budget. I'm just not for spending above the budget. What I want the staff to to hear is that we want to keep our doctor productive. We've got to keep that mindset that the reason why we were hired was to make sure that he was productive. To the doctors in the room, I want you to listen to your staff. They know how to direct you, and the doctors will learn how to accept your direction if they see that you're bringing in that productivity per hour that we're looking for. So if you work together on things, there's something in there for all of you.